Yes. First of all, I will introduce myself. My name is Rehana Perveen. I am from Pakistan and student of Texila American University. Today, my topic is job stress and coping mechanism among nursing staff in public health services. तो कर दीजिए बनाना नहीं रन करना Job stress and coping mechanism, nursing staff in public health services. The main purpose of this study is to investigation the prominent cause and effects of job stress and coping mechanism among nursing in public health services. The main purpose of this study is to examine the relationship between nurses' jobs, the work environment, characteristics of individual nurses and management support, and
Ms. Rehana, hello.
yes,
Please use the arrow button which is at the bottom of the screen to move to the slides.
yes,
Please use the arrow button which is at the bottom of the screen.
yes, arrow button. Arrow button.
Yeah, to go to the next slide, you need to do that.
Yes. Table of contents. Name of contents, abstracts, keywords, introduction, stress coping theories, methods, table of findings, acknowledgement, conclusion, and references. Arrow press. Arrow. Increase on. View. Articles. Job stress and coping mechanism among nursing staff in public health services. Abstract. The main purpose of this study is to investigation the prominent cause and effect of job stress and coping mechanism among nursing in public health services. The main purpose of this study is to examine the relationship between nurses' job, the work environment, characteristics of individual nurses and management support and coping mechanism to reduce job stress among nurses. The study uses a quantitative approach in which questionnaires are distributed to nurses to collect data. Both the current, international and local literatures are reviewed using the key themes of nursing stress and coping mechanisms. It is found that the major contributor to job stress among nurses in the job itself, heavy workload, repetitive working and poor working environment were among the stressors identified. It hoped that the result of this study clarify the relationship between the job itself, the work environment, individual differences and management support with coping mechanism to reduce job stress among nursing staff in general and private hospital, which indicate what intervention is needed to reduce stress among nursing staff. My keyword is nursing stress, coping mechanism, management support and working environment. Introduction. Job stress is the harmful physical and emotional response that occur when the requirement of the job do not match the capabilities, resources or need of the worker. When we feel stress, our body responds by raising the concentration of stress hormones in our blood. When our bodies continually respond to constant demands or threats, coping mechanisms stay in overdrive, which can damaging our health due to overtime. Research shows that excessive job stress can lead to many long-term health problems, including cardiovascular disease, diabetes mellitus, weakened immune function, high blood pressure, musculoskeletal disorders, substances abuse, depression, and anxiety. Stressful working conditions can also impact health indirectly by limiting our ability or motivation to participate in other health working conditions can also promoting behaviors such as eating well and exercising. Nursing in hospitals are exposed to high level of occupational stress resulting from heavy work, load extended working hours and severe time pressures. They are at a high risk of suffering from depressive orders than general population. I think nursing by itself, its nature, is a stressful profession. Nurses work in high stressful environment since their main responsibility focuses upon providing demands are satisfied. Nurses focuses on activating that relate the diagnosis and responsibility to ensure that patient demands are satisfied. Nursing focuses on activating that relate the diagnosis and treatment human responses to health and illness phenomena. There are many components to the experience of stress such as staff shortage of staff nurses, high level responsibilities, dealing with death, dying and dealing with the patient relations, coping with unpredictable situation, making critical judgment about intervention, treatment, balancing work and family commitments such as married nursing with children have to address responsibilities as a wife, mother and homemakers. Nursing is the stressful profession. It has been found that nurses suffer from high levels of work related stress than healthcare workers. Occupational safety and health researchers are partitions agree that the nurses are heavily exposed to varied psychosocial stress in their daily work. The term psychosocial stressor refer to stressful working conditions and job characteristics. Nursing seems to be overexposed to a range of psychosocial stressors, which include lack of control, long working hours, shift work, interpersonal conflicts, insufficient resources, poor reward system, and inadequate structure of communication, how in hospital and other healthcare settings. Camphor et al. 2011, Robert et al. 2012 says uncontrolled stress can cause emotional and physical illness such as coronary heart disease, cancer, lungs problems, diabetes, accident, and even suicide. It is not possible to completely eliminate stress from our daily lives, but appropriate ways of coping with stress can be practiced in order to reduce stress. This requires a holistic approach. The research has been conducted on job stress and coping mechanism among nurses in public health services. Job stress and coping among nurses in Pakistan private hospital is yet to be investigated. The main objective of this research is to examine the job itself, the work environment, individual and management support coping mechanism to reduce job stress among nurses in a select private hospital. Stress coping theories. Examination of the literature reviews several theories that are pertinent to stress. These include transactional based theory and complexity science theory, the conceptual outlook and preliminary findings through secondary data analysis and literature review on stress and coping are informed by the transactional based theory of stress and theoretical views of stress proposes that stress does not exist in an event. A major theme of the transactional approach, it is the importance placed upon the role of appraisal. The theory suggests that the appraisal, the primary mediator of the person-environment transaction. These types of appraisal exist within this framework, which determine emotions and coping behavior such as primary appraisal, secondary appraisal, and reappraisal. Primary appraisal, I will describe you primary appraisal. It is a cognitive process that relates the continually evaluating coping options to deal with the primary appraisal or reappraisal. Involves the process of continued evaluating primary and secondary appraisal. The transaction-based theoretical views of stress identify two forms of coping. Problem, these are two in number: problem-focused and emotion-focused. Number one, problem-focused strategies are adaptive strategies that involve managing or altering the problems with the environment or the person. Emotional-focused strategies. Number two, emotion-focused strategies involve regulating the emotional response to the problem. Individual may use both type of strategies to deal with the stresses. Coping mechanism to stress the job stress. Generally, research into coping has focused on internal and external resources for coping with stress, which deal work and general life stressors. Coping has been defined as the process of struggling or dealing with responsibilities, problems, or difficulties. Coping is also viewed as a dynamic process and responses to a situation characterized uncertainty and important consequences. The researchers use coping with stress at the hospital as process of handling, managing, and contending with the difficult or situations with the intentions to reduce
Hello?
their. Yes,
Hello?
yes,
You
yes,
got
please.
another 3 more minutes to finish. Okay?
Yes.
Yeah.
The researcher view coping with stress, the hospital as process of handling, managing, and contending with the difficulties or situation with the intention to reduce the impact or overcome them generally. Firstly, one has to attempt the anticipate potential stress before them and prepare appropriate plans to attack for the various outcome then of the reduce the physical caused. The stress has been related to the physical work environment. Several studies, poor working conditions such as overcrowded work areas, noise, heat, strong odors, and dangerous conditions are considered potential sources of stress at the hospital. Poorly defined job scope, being tasked to take responsibility for others and working on rotating shifts are among the conditions related to the job itself, and there is also impact on nurses. Another sources of job stress is associated with nurses' role, undefined job scope at the hospital, job security, work with fellow colleagues, feeling of job insecurity, lack of skills, and inability to control emotions might lead to nurses' stress, lack of confidence, which can lead to stress. Method. For this purpose of this study, descriptive and cross-sectional or correlation research design will be used to describe the demographic profiles, while cross-sectional design will be used to understand the relationship between variable. Collected can be a variable. A descriptive research design will be used to describe. Descriptive research is pre-planned and structured in design so that information collected can be satisfactorily inferred on a population. Further data that is collected from the answer given by the responder through a questionnaires